Hello, everybody. This is Jessica Davis, Marketing and Communications Manager for Fear Free. I'm here to welcome you to consider the senses of the Fear Free exam, sponsored by Virox and hosted by Dr. Julie Reck. In this webinar, Dr. Julie Reck will explore the details involved in creating a fear-free experience. She will discuss pre-appointment opportunities, easy to implement facility alterations, and exam room cleaning tips to make sure your patients have the best experience possible. Dr. Julie Reck is a veterinarian with passion for creating new communication avenues with pet owners. She believes that enhancing the communication capabilities of the veterinary profession will foster a stronger connection with pet owners and create an enjoyable professional environment for veterinarians, veterinary technicians, and receptionists. She will go through her presentation, and then we will have a quick Q&A session at the very end. If you have any questions to ask during the presentation, make sure to add them to the Q&A box and not the chat box. And we will go through all of the questions that come through. So on that note, Dr. Reck, please take it away.
Oh, thank you so much, Jessica. My pleasure to be here with you guys. As we go through this presentation, I'll be showing you a lot of the behind the scenes look at how we're making fear-free work in my veterinary practice, which is the Veterinary Medical Center of Fort Mill. We're just south of Charlotte, North Carolina. We're proud to be the first and so far the only fear-free certified practice in the state of South Carolina. We look forward to more practices joining us in that endeavor soon. But one of the mantras that we've really practiced in order to be successful with fear-free is this statement right here. Success doesn't come from what you're going to do occasionally. So as you learn the options that are available to you with fear-free, if on this day we're just going to try pheromones and see if they work and that's all we're going to change, we might be disappointed because it is really going to be the accumulation of all the things I expose you to in this presentation that is what leads to a fear-free outcome for our patients. So it's really what we do consistently that will make a difference. And this is similar to how you go through the process of falling in love with somebody. You don't go on one date and say, okay, that's it, we're going to get married. At least most people don't. Same thing with going to the gym. If you're planning on losing weight, it's not about going to the gym one time for 3 hours. So it's not about intensity. It's about consistency. And these small changes can really make an impact if we're consistent. The first thing I wanted to do was go over some data-driven results here. And this is a study from 2014. And one of the things that I find so remarkable about some of this data is when we first take a look at the canine column. And the trigger where we see the greatest signs of stress in dogs occurs before they ever enter the clinic. I found this really intriguing because when we think about how much we travel with our pets, they're going to restaurants with us, we're taking them to dog parks all the time, we're taking them on vacations with us. Our pets are typically accustomed to going a lot of places, and a lot of them really do enjoy getting that outside exposure. So if they were to come to my clinic for the very first time, and this is a seasoned pet that's used to traveling, what about my clinic is inciting high levels of fear, anxiety, and stress before they've even walked in the building? They don't even know what it is yet. And when I'm lecturing, we invite a discussion on this dialogue, and it's through our discussion that we discover it is fear pheromones secreted in the urine and the feces that other animals have deposited in and around the veterinary clinic. Now, hopefully the feces are all getting picked up regularly, but urine is another story outside. If they pee on this post or on that rock over there, we're not going to be able to eliminate all of those pheromones. So since dogs do kind of have that vagabond lifestyle and they're traveling and roaming around, sometimes as packs or sometimes as individuals, they communicate to each other heavily through this pheromone. So they're leaving comments about or a survey about how this place was. So if they were afraid and frightened the whole time and they urinate on the way out, they're going to tell every pet that approaches this building, it is not safe. You do not want to go in there. And that is sometimes behavior that we can see happen before they even walk through the doors. So really interesting data on the dog in that regard. Also, we see that it's very high, that they do not want to be on the exam table, right? That is usually a new experience for most pets, especially if they're a larger size, to be carried and hoisted up into the air on top of something that may or may not feel incredibly stable to them, that they could also fall or risk injury by jumping down. So that typically has very high statistics of fear, anxiety, and stress. When we look at the cat column, another interesting highlight on here, we see it very, very high as regards to reluctance to enter the exam room. We also see it the highest being on the exam table. This is another thing that I'll invite discussion over in my lectures. And it's really interesting because the one thing that cats are typically not allowed to do in the house is to get on, that's right, the counter or the table. And a lot of cats, when they engage in those behaviors in the house, are punished. A common form of punishment tends to be like a water spray bottle. So here we are, now we've got them into the vet clinic, and we plop them right onto a table that is waist high, which is something they're typically not allowed to be on. So it starts to make a little bit more sense when we think about how their experience translates to their normal day-to-day activities. Another thing I like to discuss on this slide is to be able to identify in conversation what is the number one fear trigger in the dog as well as in the cat species. So in dogs, number one fear trigger is noise. That's where a lot of fear, anxiety, and stress will start. A sudden, unpredictable, unknown sound is the big driver. And we see this in thunder phobias. We see this is a big part that drives separation anxiety. And it's such a common problem that there's actually the FDA approved Cilio product to help pets cope with noise phobia. In the cats, it's not noise. It's something entirely different. In fact, it's a change of environment that will trigger high enough levels of fear, anxiety, and stress that that cat may be worried of its very survival. And that is a huge takeaway for ourselves as veterinary professionals and to impart to our clients when we're explaining fear-free or why it's important to emphasize the emotional well-being of their pet while they're at a visit with us. So cats, just changing their environment, getting them in that cat carrier, getting them in the car, transporting them to the vet, could incite high enough levels of fear, anxiety, and stress that they think that they may not survive this. So this will become an important piece of data to communicate as we talk about how to build client compliance and help them understand the importance of following our recommendations. When we became fear-free certified as a group of individuals, this was back in 2017, we had some baseline knowledge thanks to our certification. The next step was to actually make a plan for how to implement these knowledges and where to start with some of the changes. For our practice, the first thing we looked at was the patient flow. We began this in the parking lot and in the lobby. So these are 3 pictures from my practice, different angles of the lobby, so all the same room. And there are some features of the lobby that are big advantages for us. And there's also some features that are a bit of a setback in regards to fear-free. And without a current budget to do big construction activities, we've needed to just take a moment to recognize what works well and what is a limitation. And that way we can educate our staff on how to be the best advocate for our patients possible. Some of the things that work well in the lobby is the fact that it is very large. It is very open. That leaves us plenty of space between patients. We also have different zones of the lobby. So we have an area that's set up as a classroom. We have the big round desk that could be a visual barrier between 2 animals that were staring at each other or barking because they could see each other. And then we also have the retail space. So definitely have different areas for people to wait, particularly with different species of animals. Some things that are disadvantages is we don't have separate species entrances or waiting areas. So we know that we could potentially have commingling of our patients there. And that's been important for us in training our staff on how to make sure all pets have a fear-free experience. Another aspect is once we get into the exam room, actually considering some of the sounds. I think the first step with this is making sure we are recognizing, reducing, or eliminating any sudden unpredictable sounds. Like in our practice, we have large wooden doors, and it's actually quite easy to slam them. So what we did was we put automatic closing hinges on the door. That way we don't ever have to make sure, because the reason they're getting slammed is we want to make sure that a patient does not escape out of the exam room and then risk injury running through the hospital, or even worse, getting out loose beyond the hospital. So our staff are always very eager to make sure that the door is shut and be confident of that. But with the door closures on there, that's already going to happen as soon as they leave the room, no matter what, and it just does it more softly. Once we've eliminated any unnecessary, unpredictable noises, we can then also think about what we want to replace the noise with. And calming music is extremely helpful. A lot of different ways to do this. We all have smartphones nowadays, so even having your own smartphone in the room could be one solution. If you have a computer in the exam room, you can utilize a YouTube playlist. There's a lot, such as Through a Dog's Ear, and other pet-related sounds. In my practice, we subscribe to Amazon Prime to get a lot of our supplies delivered, and that will give you access to hours upon hours of species-specific calming instrumental music. It's really fascinating because in what they've studied about species-specific music, whether that's the Pet Tunes boxes or Through a Dog's Ear, the aspect of the music that is responsible for helping to reduce fear, anxiety, and stress is the beat of the music. So the beat of the music is to that species resting heart rate. And that'll be, if you have a cat playlist versus a dog playlist, that'll typically be the slight difference between the two. Depending on your practice and how much of each species you see, it may not be right or wrong to worry about focusing so much on each. But typically soft instrumental music. Also, studies have shown reggae music has been relaxing, as well as audiobooks. So a lot of places that have boarding or animal ward areas are playing audiobooks in those areas, particularly The Lion, the Witch, and the Wardrobe. Apparently the cadence of the way that book is read is to the resting heart rate there. Another aspect, just to show you the power of these incorporating music into the exam room, is here. This is actually a screenshot from a social media page that my practice posted. It was Peanut Butter Lovers Day, so we used one of these samples from the Fear Free Toolbox and made it a post. And one of our clients commented below saying, "Peanut butter is always a yummy thing. The addition of having soft playing music in the exam rooms is now great." So even if you're of the mindset that, you know what, I really don't think that the music is actually going to calm my patients down, it a lot of times offers a lot to the client or the person that brought the dog in. And sometimes helping them calm down is half the battle. So if we can achieve that, we may be stepping in the right direction there. So looking at our patient flow, considering the noises in the exam room, again, remembering that noise phobia is the #1 fear trigger in a dog, is some of the beginning steps to consider. Another approach is making sure that we have the calming pheromones and that we're applying those correctly. We actually do a layered pheromone approach in my practice, so I'll be explaining that in the next couple slides. But in our exam rooms, and we do not have species-specific exam rooms, so we see both dogs and cats in the same day in all of our exam rooms. But in each exam room, we do have Feel Away as well as Adapto plugged in. Thankfully, we can have them both circulating in the room at the same time because the opposite species cannot recognize the pheromone of another species. They do not have the receptors, which is thankful. So the adaptyl pheromone will not scare a cat, nor vice versa. Now, interestingly enough, when we first started using the pheromones, we just had them plugged into the outlet with nothing else going on around them. I found out from my SIVA rep that they offer these complementary wall clings that can go right around the outlet where the pheromone is plugged in. And I was very excited about this because what would we guess clients just think that that object plugged into the wall is? A Glade plugin, a $2.99 Glade plugin. And certainly our investment in diffusing pheromones is well more significant than just $2.99 for a little air freshener, right? So I want clients to understand that this is a detail that we've considered and that we are investing in for their pet's experience. So I really do like the wall clings because it does lead to that awareness that this is something special and something that was specifically picked to benefit their pet that is in that room. The other aspect that I've really liked about it, particularly for Feel Away, is that because of the pheromones, as well as the calming music and some of the other tips and tricks that I'm going to share with you in this webinar, the cats are oftentimes notably calmer than they have ever been in this type of situation. And the clients, by the time I get into the room as the veterinarian, are now commenting on this. And they're saying, wow, he's doing great today. I've never seen him so calm in such a scary situation. Do you think that this item that you have plugged into the wall, do you think that that's helping? And I'll say, I absolutely think it's helping. Their next question is, well, gee, he gets really scared whenever I have company over for dinner or a party. Do you think this would be good to have in my house? And I always nod my head and say, absolutely. I've been saying that for 10 years now, but now that it's your idea, they're more ready to invest in that for their homes. So not only is it helping them recognize the value of what is being offered in the rooms, it's having them decide that this would be a good addition to their family. So we're adding that mental enrichment and supporting the pet, not just in the veterinary clinic, but now also at home as well with this. In the right picture over, you'll see that I have the scale, and the pheromone is plugged right in next to the scale. That's for adaptyl, and that has been a very helpful place for us to have that. So we have them in the rooms. Keep in mind that it takes 4 to 6 hours for the pheromones to actually disperse through even a 10 by 10 exam room, which means that it may not be advantageous to take them out of the outlet at night in an effort to conserve and not be wasteful of the pheromones. So we do leave ours plugged in all of the time. You do need to be mindful that you are switching out the actual diffuser, not the refill, but the diffuser at least every 6 months, because they do, they can become a fire risk after that. And we are always dating ours and making sure that we're changing them out routinely since they are plugged in all of the time. Now, I mentioned we were going to talk about this layered approach with pheromones. So we have them diffused in the air. The next layer we want to make sure is that our patients can enjoy direct contact with the pheromones. So in the left-hand picture, you'll see we can do that via a bandana on the dog. And we don't get enough of the adaptyl bandanas to be able to gift one to every patient. So we have an employee once a quarter go to the local fabric store, and they purchase a variety of fabrics that are on sale. And we cut the bandanas into 3 sizes, small, medium, and large. And the adaptyl is sprayed directly to the bandana. And then the bandana is given to the pet parent when they are checking in. The pet parent will put it on their pet. So that's how we're doing it for the dogs. It's been really fun to see how much they are enjoying just that little gift. We get lots of social media posts of clients really appreciating that they got that little gesture on there. It's also a great way when the receptionist is passing that bandana to the clients, it's a great way for the discussion to happen. Oh, by the way, this bandana has been infused with a calming pheromone because we really want your pet to have an enjoyable experience and not be afraid. So for cats, we're able to do that via a feel away sprayed towel. So our typical patient flow is that a feline owner will come right to our desk. The receptionist will have the paperwork ready to go. We'll immediately escort them into an open exam room where we can set the carrier down on the ground. We'll open all of the openings available to the carrier. Ideally, that would be a carrier that opens from the top as well as from the front or even both sides. So we'll open all of the openings, and then we'll put the feel away infused towel that will also have catnip and a couple freeze-dried salmon treats on the towel right at the opening of the towel. We typically now see about 70% of our feline patients actively choosing to leave the carrier to explore the room on their own by the time the veterinarian is ready to go in for the exam. That's an entirely different experience than when most of your patients are still holed up in the carrier and you actually have to either take the carrier apart or extract them from the carrier through one of the openings. When the cat has voluntarily chosen to explore and that they feel safe and comfortable to do so, that is a huge improvement in how the overall exam will go. This is very important for us to consider here. We want to be mindful that we do not forget about the equipment that is going to directly contact the patients. And this is important in not just whether or not we apply pheromones to this equipment. It's also important in whether or not how clean we have the items in the first place. And when we are cleaning, we want to make sure we're not using a cleaner that has a deterring smell that would incite fear, anxiety, and stress as well. So I can't tell you how many times early in my career I have been moving through part of the exam of a cat, getting through looking at the head, the face, the eyes, and now it is time to get my stethoscope either around from my neck or off to the side, put them in my ears, and then bring that over towards the patient to listen to the heart. I've learned how to do that in a very smooth fashion, but there are some cats that the moment that stethoscope even comes near them, they're swatting at it, they're hissing at it, and there's a notable change in the exam at that moment. We see the FAS level go up dramatically. And a lot of times I just blamed that they had a negative association with the stethoscope itself. The cat could recognize that that was indicating I am now getting something done medically to me. And in reality, from even what we know from the data on the first page, that cat was afraid the moment we changed his environment. I don't think just knowing that piece of medical equipment showed up is what did it. It's probably that piece of equipment that I've used on the last 20 animals all day long smells like the Rottweiler room I just came out of. And now I'm asking the cat to allow me to touch him with that piece of equipment. So we really need to be mindful of the stethoscope, the otoscope handle, the ophthalmoscope handle. These items that we expect to touch the patient with really need to not only be ideally have pheromones on them, but bare minimum, at least clean from the smells of other animals on that aspect, which brings us to discussion of how we are going to maintain the biosecurity as well as the sense in our hospital through the cleaning products that we're going to choose. So in my practice, we're really big fans of the ready-to-use rescue products. So we have the wipes in every exam room. We also have the ready-to-use spray product in the exam room. I was very excited when I did learn that this product, because it's accelerated hydrogen peroxide technology, it breaks down to water and oxygen when it is done disinfecting. So it doesn't leave a lingering chemical smell. I was very excited to find that detail out, but I was extremely excited when I found out that the ready-to-use products are bactericidal, fungicidal, and virucidal with 60 seconds of contact time. That was a game changer. A lot of other products that we're using, like trifectant, even bleach, can take as many as 5 to 10 minutes before those products are killing non-enveloped viruses such as parvovirus. So for us, this has really been able to change our protocol in between patients and how quickly we can get an exam room turned over, which is again important because I've communicated that our goal is to get patients into the hospital, avoid any stressful patient-patient interactions in the lobby, and then be able to get them into the exam room. Well, in order to do that, we need the exam rooms to be clean and disinfected and scent free as quickly as possible. And the rescue product does a great job in allowing us to do that. So avoid that nose blindness. Let's also be mindful of the footing that our patients experience. In the left-hand picture, and I apologize, that's a screenshot, it's not a video. Some of the details I want us to note is the footing. We have an epoxy, a seamless epoxy footing in our practice. It has a very high coefficient of friction, which does allow our patients to not experience a lot of slipping and sliding, regardless of putting a mat under them if they're walking on the floor. So you can see this chocolate lab is, she's not having any problems. So if you're shopping for new footing, be mindful of the coefficient of friction of the product that you are selecting. And that's a very important question if you're building or renovating a practice. Also in the background, you'll see a towel bar, and that is holding the black and white mats with paw prints on them. These are the Pet Vet mats. They're about $20 to $25 a piece. We keep about 6 to 8 of those in stock. They disinfect and clean really well, and they do not clog up your washer and dryer, so they don't make laundry worse. If you've been experiencing kind of trouble maintaining the laundry because you're trying to equip your exam tables or your flooring with non-slip footing, then try some of these cleanable mats. We really do like that. That towel bar has been helpful, and that area of our hospital leads to the entrances of our 5 exam rooms. So we never walk into the exam room without one of these Pet Vet mats in our hand in case we need to examine one of our patients actually on the table to get them at eye level, etc. In the right-hand picture, there's 2 things I'm going to point out. First of all, in the corner, you'll actually see that there's a treatment table with a black mat on it. And that's the little black that you're seeing in the corner. That's a Shoreline product. And I really do enjoy that. That lives on the tables in our treatment area 24/7. They do not slip and slide off of the table, and they're very easy to keep clean. They also reduce the noise of a pet vibrating on the table. So we had, in our fear-free journey as a practice, we had become really good at remembering to bring a mat into the exam rooms, but we were still really bad about these quick in-between appointments, or these technician appointments that we call them, which is a quick nail trim or a Bordetella booster or a quick heartworm test. We were constantly picking up our patients and putting them on the treatment table without any footing. So we're putting them on a cold, slippery stainless steel table. So it really required some thinking outside of the box and some thinking about how do we make this effortless for our team, so that we can provide these animals the surfaces we want, we can keep it clean, and we cannot have to take the extra time to walk back and forth to different parts of the hospital to get the footing that we need. So that Shoreline mat runs about $50, and it will last us about 9 months before it needs to be replaced in the practice, just from the wear and tear of the nails and scratches of our patients. The other thing I want to talk about in this photo are the little cups of peanut butter. So we're going to be talking about what we use in my practice for high value positive reinforcement. Of course, peanut butter is one of them. There's a story behind where these cups came from in my practice, and it originates when I was seeing a patient for a wellness visit. It was kind of like a Havanese Shih Tzu cross type dog. It was probably 5 or 6 years old, and it was definitely time for this dog to have a dental cleaning procedure with x-rays and potentially an extraction or 2. So the estimate that I was presenting this pet owner with was about $800 to get this basic medical care done. And I find that if we can get the pet distracted and enjoying some aspect of the exam or a treat, that can allow me to have a more productive conversation with the owner. That way they're not worried about the pet being nervous or fretting. So I don't mind if the pet is calmly resting in the owner's lap, that's fine, or in my lap, again, that would be fine. But in this case, this little pet loved peanut butter. He was so happy to be licking even tiny morsels of peanut butter. So I had a pretzel rod, and he was licking the peanut butter off the pretzel rod. And in my practice, the doctor team, we've discussed any health risks with the peanut butter jars getting contaminated. And frankly, we vaccinate and create a vaccination plan that would protect our patients from any kind of concerns we'd have with those. So we weren't overtly concerned about the quote unquote double dipping into the peanut butter jar. But nonetheless, just in my discussion of recommending this dental procedure and what the value was for this owner, I had gone and gotten another scoop of peanut butter on this pretzel rod for this pet. And she immediately stops me. She said, "You double dipped." And I had to then kind of take a backspin, and I almost lost selling this client on the value of this $800 dental procedure because she was so caught up and caught off guard that I had quote unquote double dipped and worried that her pet would be at risk because of that. So I came out of the room and said, guys, our practice, the aspects of care that we're emphasizing, I think we have to have a individual solution for these peanut butter servings, which is how these cups got born. We get about a box of, I think, 1,000 of these at the time on Amazon. They're really inexpensive. Even a staff member who is on day one of being hired, if they're an entry-level staff member, day one of being hired, could easily be explained how to refill these within the first 30 minutes of them working. So we'll have externs do this for us. High school volunteers this is a great activity that's very safe for them to engage in, so that we're really ready and stocked. It's also unbelievable how much time it saves. We're not having to get the peanut butter out of a cabinet, unscrew the jar, get an item to hold the peanut butter. We're not risking any tongue depressors getting eaten. And in fact, clients can actually hold the cup, and it's very easy for them to hold the cup without getting their hands dirty. So just a little helpful recommendation for how to keep the peanut butter handy. Another aspect of thinking about how our patients can have a fear-free vet visit is being mindful of the e-collar. And this e-collar came out probably about, I want to say 18 months ago. It's called the Calmer collar. It is available through most distributors. I know it's available through Patterson as well as MWI and probably Henry Schein. But the Calmer collar, one of the best things about it is that the patient can rest comfortably. You can see in this left-hand picture here, we've got Brady who's resting comfortably after a big bout of pancreatitis. And this is a picture that his owner took and posted on our Facebook page. And they were really thankful that he was able to rest comfortably in that. So the nice thing about these collars is that they cost the same as these fabric blue collars. So if I go back to the previous screen, these Calmer collars are really not any larger of a financial investment. They machine wash incredibly well, so you can actually prepare your clients for using them multiple times. And their lining of them is fabric, so they would support holding pheromones very, very well. So nice options with the Calmer collar. Another aspect that we've addressed in my practice, again, we are practicing in South Carolina, so be mindful of your state. This may not be allowed with your state's Practice Act, but we met as a doctor team and we collaborated on the value of taking a full TPR every single time the pet is in the building. Again, we're in South Carolina. It's hot 10 out of 12 months out of the year. So it is very normal for us to have a routine healthy visit on a rambunctious black lab, and he's running around the room owner says, I have no concerns that have been ongoing with him. We take a temperature, it's 102.8. We write it in the record. We don't give it a second thought and we move on. And we obviously all know that that is a high, that is an elevated temperature. Our doctor team has made the decision to eliminate baseline temperature taking if we feel that no matter what those results would be, it would make no clinical difference or change of direction. So if I'm looking at that dog, the owner's not presenting me with any complaints, he's here for a wellness overview. If no matter what that dog's temperature is, it's not going to change my game plan, then we don't see the value of taking the time, putting our patient through the negative experience, and putting ourselves and our staff at risk to get this information done. A lot of this decision came from the research that Dr. Steve Nettinger is doing with Fear Free and comparing vital signs and finding how inaccurate vital signs can actually be when fear, anxiety, and stress is present in the veterinary facility on that regards. That being said, we do still take temperatures on brand new patients. We always want to get a baseline. We will take temperatures anytime there is a medical concern, and really anytime the doctor does feel that's appropriate. In some cases, if we want to prove that that patient has historically run a little high, maybe we will track temperatures on that patient. But it's something that we've stepped away from doing a hard and fast TPR, getting a temperature. We will get a pulse and respiration on every animal every time they're in, but taking the time to do the temperature has kind of been something we've moved away from. We are an AHA accredited hospital and we're re-accredited just last May. And this is something we discussed with our evaluator. They were very up to speed on some of these fear-free movements and recommendations, and that was not a problem for us in our evaluation. Another area to focus on is injections. And this is important regardless of whether we're giving a vaccine or whether it's a shot of Syringe or something else along those lines. But being mindful of the materials we're selecting for the injections, how we're presenting ourselves in regards to delivering the injection, and then how the actual injection is being conducted. So in my practice, we are using fresh needles. So in the left-hand picture, you'll see this is looking at the low volume vaccines. This is actually a picture on the right of the ultra vaccine. It's only a 0.5 ml versus the standard 1 ml volume there. But in order to reconstitute a vaccine, we have to go through a rubber top twice. And each time we do that, we're dulling the needle. So by the time it then goes into our patient, there's significant drag on that needle from being dull, and that does incite more pain and the injection will be more noticeable to the patient. So I'll always put a new needle on. And then many times, if it is a very low viscosity fluid, meaning that it's not thick, it's not hard to press the fluid out of the needle, then I'll usually put a smaller gauge needle on it. So traditionally, a lot of 3 ml syringes come with a 22 gauge needle on it. A lot of times when I'm ready to inject it into the patient, I'll switch it to a 25 gauge needle. When we think about dropping needle size, there's an important consideration that we have to factor in with that. And that is making sure that we don't increase the pressure that the fluid is delivered into the subcutaneous tissues because it is a smaller opening. So if the opening is smaller, just like when we kink a hose, but we still put the same amount of force and the same amount of speed on the contents of the fluid, we could actually jeopardize the subcutaneous tissue and cause more reactions, whether that be a small bump to be formed or a small little area of inflammation to be formed, if we're not being mindful that we control the speed and the pressure with which the injection is delivered. So again, I put on a smaller gauge needle, but I also slow down the injection by about 0.5 to 1 second. And I make sure that I'm never having to press harder than what flows easily through the needle hub on that. Utilizing the touch gradient is very important when it comes to injections. And when I say the touch gradient, I'm sure all the fear-free certified professionals on the webinar are quite familiar with that terminology. But basically, one hand, once it makes contact with the patient, will not leave that patient until I am done with that procedure. So I am a right-handed individual. So when I want to do a vaccine injection, say that this is going to be between the shoulder blades because it's a distemper parvo shot, or it's going to be over the right shoulder. I'm going to approach that animal from the side. I'm going to get contact with the animal with my left hand, and I'm going to kind of use that hand to go up and down the body, begin to rub and desensitize the area that I'm going to vaccinate that pet. Meanwhile, my right hand is gathering the equipment, the syringe, making sure that I have the needle cap pulled off. And now my right hand can join my left hand, and I'm no longer just startling the patient by spinning around towards the patient and then just giving it a shot. I've been in contact with the patient the entire time. And that's one of the most effective ways to make your vaccine experience or your injection experience invisible for your patients, is to always be mindful of your touch gradient. Also, if you have any patients that have become visually sensitized to a needle and syringe, we always have the opportunity, if it's a cat or a small dog, we can do a pheromone infused towel over their head and then just prioritize the vaccines to the rear legs or the rear aspect of the body. If it is a larger dog, we've used adaptable sprayed quilts to at least kind of block the peripheral vision so that I can get an injection into the back end of the pet. Sometimes we'll actually use that as a method to do injectable sedation for a high level FAS dog. Again, I promise you that we review a little bit of the common things that we keep in our exam rooms, in our treatment area. Of course, the pretzel rods in the lower right corner are a great way to deliver the peanut butter without the risk of them ingesting the tongue depressor or some other device. The lower left corner, you'll see the free food measuring cups provided by the manufacturer. A lot of times we will smear those with peanut butter and throw those in the freezer so that it's frozen. And that's a way to help a pet not eat as much of the peanut butter as they normally would. It slows them down a little bit. The liver paste is always a big hit, as well as the easy cheese. I think the top flavor of that is the bacon cheddar. Spray cheese tends to be the most rewarded. I'm also very surprised by how many cats like the spray cheese. If you haven't started offering that to your cats, you may be pleasantly surprised at how many will be interested in licking that. The Zoox training treats are a nice option because they are so small in size, and they also have some that could be novel protein friendly if you have some patients with food allergies as well. The latest studies show that we really need to have 40 to 60 treats present in order for that pet to have a lasting positive experience. That seems like a lot, I know, but a treat is literally the most tiny morsel that you can actually hold in your fingers. So we can break that up to be very, very small if we need to control calories on that regards. This is a screenshot from an email from one of our relief veterinarians when we were pretty new to Fear Free. So she had relief for our practice prior to joining Fear Free, and then got scheduled once we had adopted some of these new techniques. And after a while, I got this email from her, which says, I'm 100% going to keep a jar of peanut butter in my work bag from now on. It's causing me fear, anxiety, and stress to not have that option. So to me, it was a real testimonial to the difference that being proactive with the positive reinforcement, having it readily available, providing it to our patients from the moment they walk in to every time they experience something in our veterinary facility, as opposed to only offering it once the pet has exhibited high levels of FAS, was really showing that we were moving the needle a good bit on that regards. Cats look different. So I spent a day early on in my fear-free journey with a cat-only veterinarian with 20 years of experience. And I really had an in-depth discussion with her about cats and their typical non-willingness to eat in the veterinary clinic, right? And she said, Julie, of course, cats are not going to be as food motivated as dogs. They're just not. That means we need to engage other instincts with this species. She says they're an obligate carnivore. They are way more geared toward hunting and tracking than the dog even. She says, I always have a cat toy in my exam rooms. And she almost lost me when she said that, because traditionally, this cat toy that's pictured in the center of the screen to me looks like something that would just harbor pathogens and be a terrible idea to have in my exam rooms. So I let her finish, and she said, 90% of cats will not even engage with the toy. They will not touch it at any point in time. But if I have it out and I'm moving it while I'm asking questions for the history, while I'm going over my treatment recommendations or my diagnostic rule-outs, 9 times out of 10, that cat will actually follow it with their eyes. So they will be tracking it. They may not engage with it at all. But in those moments that they're following it, they are forgetting that they are in the scary environment of being in the veterinary clinic. So utilizing their other instincts is really an asset with the cat. The lower left-hand picture is this brand of catnip called Yow. I get this on Amazon. That's a very large tub. It's larger than my hand in the shape of a fist. So it's quite a bit of catnip. It runs, I think, about $7.50 on Amazon. So that will last you a good long while. That is my favorite brand of catnip. Very potent, very universally well received by a lot of our patients. The freeze-dried salmon treat brand that we like is in the upper left-hand corner. Meow Juhana, that's always a fun little product to have on the exam room shelf. It's a good conversation starter. Marshmallows can be a great option for cats, as well as what's pictured in the lower right is a piece of honeysuckle wood. This was new to me. I found this out through listening to a behaviorist lecture for Fear Free. But honeysuckle has an oil in it that is as attracting to cats as catnip is. We have 4 of these, and we will sometimes put them on the towel for the cat to experience when they come out of the carrier. It is so fascinating to watch, because a lot of times it's the first time that cat has ever interacted or smelled honeysuckle wood ever. So they are so intrigued and they're so infatuated by that honeysuckle wood that they are completely unaware that they're at the vet. So it's really funny to see them play with that item and engage with that. Of course, we can't have a full fear-free experience without being really proactive and advocating pre-visit pharmaceuticals for our patients. So this is just a quick rundown. I know this was not our main focus of the webinar, but it's part of our exam room experience with almost every patient that we interact with. If we're not recommending pharmaceuticals, then we're recommending nutraceuticals to prevent fear, anxiety, and stress from ever happening. So for canine patients, usually our go-to nutraceutical is going to be Zilkene. And that is great for if you have a patient that frequently is stressed out during boarding or getting stress colitis. I'm always recommending that they start Zilkene about a week before boarding, or even 2 weeks before boarding, using it through the boarding process and being able to eliminate some of those stress colitis vet visits after they pick up. Normally for PVPs for dogs, my starting point will be trazodone at 8 to 10 mg per kg. That is higher than what you will see listed in plums. It is important that we do a loading dose the night before and then 2 hours prior to the vet visit. Technically, if we just want to go on a numerical timeline, we need to give it roughly 8 hours before and 2 hours before the appointment. So if you're seeing a patient at 5 p.m., maybe we want to have a dose first thing in the morning and then around 3 p.m. and then have them come in for the visit. If trazodone is not enough, then I will routinely be adding in gabapentin. And again, this is a much higher dose than what we dose for pain or analgesia management. This is the anti-anxiety dosing of that. So I'll do anywhere from 25 to 35 mg per kg. Same thing with the loading dose. I will use these 2 doses in combination. We'll talk about Cilio in a little case study that I'll present at the end, but that is an option when we have extreme FAS in some of our patients. We've also, the nice thing about trazodone and gabapentin is they're generics. They're very inexpensive. Some practices will get them compounded so they could be flavored, and that's a great option. Others are just using the generic. We adjusted our RX fee, which is a fee that most practices will have attached to every single item that is sent out via prescription. And that helps cover the staff cost to make the prescription, the label, the bottle, and so forth. Because we're not always sure what product will work best on each dog, I don't want to send a client home with 4 trazodones, having them spend $20 on the pennies of trazodone I just sent them home with, and have them be discouraged about trying other PVPs because they don't want to spend $20 every time we try something new. So I adjusted it from $15 down to $5.50. For cats, we all know gabapentin is really the king here. 100 milligrams will work great for the average size cat. So we're talking anywhere from 8 to 10 pounds. If I have a cat with high levels of FAS, so 4 or higher, or if I have a cat feline patient that is larger in size, maybe we're 12, 13, 15 pounds, I may bump that up to 150 milligrams of gabapentin. Same schedule, the loading dose, 8 hours or the evening before, and then 2 hours prior to the appointment. We have a lot of luck of just having our clients pull the capsule apart, sprinkle the contents onto wet food or baby food. Whenever a client tells me that the gabapentin did not work, my first thought is that they were not able to get it in the cat, even if they feel strongly that they did. Somehow the cat likely did not get it. So I always tell my clients to put this in just a small teaspoon of cat food or meat flavored baby food. Let them eat that first, then they can have the rest of their meal. So that way the cat is very hungry when it is being offered the gabapentin. This is a prescription product, which in our state, I can only give when we have an existing client-patient relationship. So a question I get commonly asked in lectures is, what do I do when I have someone calling knowing that they have a cat who has a lot of fear and maybe even signs of aggression at the vet clinic, but we've never seen them before and I cannot prescribe them anything? Or they're calling because they want to get the cat medical attention, but they cannot get the cat in the carrier. My favorite thing for cats is Zilkene. Zilkene is a milk-derived protein, and it works on the GABA receptor. It is the chemical responsible for the milk-drunk feeling that a mammal experiences after nursing. So the baby, when they feel warm, safe, and content, they drift off to sleep after nursing. It is this chemical that is hitting that GABA receptor. So just as that sounds familiar to gabapentin, there's a lot of similarities in how Zilkene and gabapentin work to relieve anxieties. The great thing about Zilkene, it is an OTC product. There are no side effects, there are no contraindications, regardless of what other medications they're on, regardless of any pre-existing disease states that they've been on. So cats typically will get a double dosing from me on that. So if I have a feline patient who I don't have a client-patient relationship with, and they definitely need emotional support through some kind of nutraceutical, I'm going to pull Zilkene off the shelf and I'm going to give them a 225 milligram capsule. We sell it in the 14 count blister packs in my practice. So I'll have a client walk into the practice, they'll pick up their 14 count, they'll go home. I'll probably have them start that a week before the exam if I know this is a pet that has done really poorly at previous veterinary visits. So a week ahead of time. If all you have is the night before, no problem, but this is something that does accumulate in their system, and you'll see additional benefits if they're on it for a little bit longer. So that's my plan with cats on that regard. So again, this slide is asking, can we really have an impact with how we set up these exam rooms? In the initial slide, I showed you the data of when cats get most notably stressed. It's when they enter the exam room, it's when they go on the table. So I'm gonna play this video, and this is a video of a technician in my practice, and she is setting up the ideal cat room. I actually created this video footage to help us create case studies for fear-free symposium workshops we were doing last year. And we wanted a video of a technician setting up the most ideal cat room. And we also wanted to examine a cat in there. So I have Shiloh setting this up. Is that a nice warm towel for her?
Of course, fresh out of the dryer.
Awesome. She's gonna love that catnip. Okay, so in this picture here, you can see we have a litter box in the corner. We have a water dish. Behind Shiloh is a little can of cat food that is freshly opened. We've got the warmed towel with catnip, and we're putting the freeze-dried little salmon treats on there. We have seating that the cat cannot crawl under for the client to sit on. That's important. And we also have a little hiding box for the cat. So you may be asking yourself, like, ooh, goodness, does any of this really matter? This seems like a lot of work setting this up. And truth be told, I don't set up the room for every cat this exact way every single time. But after I encountered this experience with this patient that you're about to see, this is Gracie. Gracie is this little black and white, beautiful female cat. She had visited my practice that day because she had a swelling on her cheek, and it turned out to be a cat bite abscess. So she was great in the exam room. This was, just the dream cat. FAS 0 to 1 the whole time. Owner was amazing. Just a really wonderful initial exam. Gracie needed to stay with me so that she could have her abscess lanced and be taken care of. And I remembered I needed to get this video footage. So I thought this will be a great patient for us to set up the perfect cat room, get the cat exam videoed, and be done with it. So my beautiful, perfect feline patient gets asked to go and change her environment again, gets asked to go back into the exam room, and she turns into this. Level 4, nothing like it. At this moment, I'm actually laughing hysterically because I'm pretty sure this is going to be a waste of time, and I'm going to need to find a new patient to video this cat exam on again, because what normally happens, you can even see in her body language holding still, see her paw outstretched, it's expanded. She's thinking about scratching my dear technician from face to bottom there. So typically when cats have made this decision to be afraid enough that we now actually have to be defensively aggressive, that's kind of a wind up process. In cats, they're not quite like dogs. We can't reason with them. We can't usually get them to unwind in the veterinary clinic setting. So if we were to put her on the exam table and immediately start with an exam, it probably would not go very well. We may need to add restraint. People could get hurt. The cat would continue to escalate in fear, anxiety, and stress. Instead, let's watch what actually happens here. So, yep, she's not happy. Body language is showing all those things. Again, looking at our data, we know that going into the room is a trigger. We know she doesn't want to go on that exam table. So, again, I think this is our footage of it unraveling more here. Okay. So she gets put down. I'm laughing hysterically. I think this is a big fat waste of time. Honestly, I'm kind of at a loss for what we're going to do at the moment. So we just give the cat an opportunity to explore the room. So she was a level 4. Now she's noticing the hiding box. Ooh, the litter box. Ooh, my tail is moving. That is interesting. Taking a look at everything. Ooh, now we've got this yummy food. We're not going to eat it, but we sure did appreciate smelling it. And I was able to then, within about 10 seconds, go ahead and move forward examining that cat. And she was great. Would have gone much, much differently if that folding table that is right behind my head was dropped down as that cat was hissing, and I continued to direct Shiloh, my technician, to put the cat on the cold stainless steel table because I need to hurry up and get this cat's exam done. Would have been a completely different experience. So this was a huge learning moment for myself as well as my team in the power that just setting up that room can have on how some of these cases go. And before we finish today, I just wanted to share with you a case study of what I think is sometimes one of the most difficult situations we have in veterinary medicine. So this is the nail trim that will not let you touch him anymore. So meet General. General is a German Shepherd mix. He's 2-year-old male neuter. He was recently adopted from the shelter by a very nice middle-aged couple that are empty nesters. So they really have fallen in love with this dog in the last 2 months. They take General to a lot of places with them, and he's doing great. He's doing great house training. He's not having any destructive habits in the house. They're going for walks. He's showing no owner aggression, but they have taken this dog to 3 veterinary clinics, and he has continued to get worse with each nail trim experience. So much so that the 3 that they've taken him to are now refusing to see him for this. He's a danger to their staff. He is lunging at the staff. He is just overall making this not an option. The owners are very distraught when they initially contact my practice. We set up a consult, and we were very, very clear with them that in this consult, there was actually no plans to physically touch General. I was prepared, and hey, if we were all pleasantly surprised, if General was just not afraid in my practice at all and he allowed an exam, then of course I would be included with their consult. But based on his history, we were very clear with them that we felt that that was not likely going to happen. They were still to bring him so that we could visually assess him, visually assess his body condition, his hydration, his behavioral status, all of these things to establish a client-patient relationship with him. So that's what we did. In true form, he was great with his owner, but anytime he even thought I was going to make a step towards him, he would posture up, he would bristle the top line of his hair coat, he would get a more stark gaze, he would move forward, and I was quite confident that if I took one more step, he was probably going to lunge at me at that point in time. So definitely an intimidating situation on all regards. He weighed about 70 pounds. And so we sent him home with these 2 medications as Previsit pharmaceuticals, and they gave this to him 8 hours before and then 2 hours before the appointment. We also did something else differently when it came time to his actual nail trim appointment. His behavioral aggression was really situational. He has associated being at the vet with a situation where he needs to actively defend himself. And unfortunately, he's had experiences that have caused him to feel that is his only option in the veterinary clinic. So to reduce that, when the client arrived, I told him not to get out of his car. He called from the parking lot. I went out to the parking lot. I went in plain street clothes. I had a Dactyl sprayed on my clothes. In my back pocket, I had a injection of a combination of dexdomitor and butorphanol, and was ready to give that if he would have allowed it. Much to my surprise, this dog was as pleasant as could be. He was pleasant with his owner. As I grew more confident in his body language, I then asked the owner if I could have the leash for a few minutes. I walked him around the facility. I was petting with him. I was interacting with him, and it was fantastic. I thought I had an opportunity to be very slick and pull out my syringe and just quickly get an injection between his shoulder blades subcutaneously. General's way, way too keen for that. He's got some really good peripheral vision, and he saw that no matter how sly I tried to be. And the moment that he figured out that was around, he was back to not having it. So this is the traditional patient that we've had to pull the leash through the door and create the squeeze chute option. When you do that enough times with patients of this size, that's when we start to really see that the lunging behavior will happen, because he says, oh, no. If I'm not going to give you the opportunity to get me in that predicament again. If you try to do that, I will attack you. And that's where General is right now. So the next thing that we went ahead and did, since he was still too reactive to safely give an injection, I had the owner administer his labeled dose of Cilio, which is the oral dextroatamine. His labeled dose is 5 dots. Now, the labeled dosing on the Cilio is roughly 1/4 of an injectable dose. And having that little information in your head is going to help you titrate out. Ultimately, if we give him 1 or 2 doses of Cilio, then we can change what we're actually going to inject him with, so that we don't risk it being too much for his system. Again, I want to emphasize that my decision to have the owner administer this is for a couple reasons. One, the dog has never shown aggression with the owner. If that is in the history, we discuss immediate need to go for a referral to a behaviorist. We talk about how really that pet's life is in jeopardy, and we need to get this situation under control in as quick of a manner as possible. And that is really through the advice of a boarded behaviorist. But because he has not had any problems with mom and dad, we had them administer the Cilio. Again, keep in mind that Cilio is designed and sold to be given by the owner of the pet to the dog. So we are well within how the medication is labeled to be prescribed in the first place. I stepped away while Dad gave the Cilio. They waited in their car for another 10 minutes. I set a timer and went in my office and continued to work on medical records while they were waiting. And we went ahead and then came out 10 minutes later. I reduced the injection dose by 30%. I was able to give him that injection between his shoulder blades. He was asleep within 5 minutes. It was after I gave him the injection that we walked him into the veterinary clinic and put him in an exam room. The nail trim was successful. The way we handled charging for this is that we just have a sedated nail trim, like an injectable sedated nail trim fee. It's $150 for this nail trim. It doesn't matter what we need to do medication-wise to get the pet to that point, and in some cases you could argue if this was a 150-pound Great Dane, of course you're going to need to use more drugs, maybe more Cilio, which can get expensive. I do understand that, but typically you're making it up in the profit margin that is available on the smaller patients. So it's kind of a wash. And when we have situations like General, we talk about the option to do behavioral conditioning over time so that he can slowly become more accustomed with this procedure and he doesn't need to have it done under sedation. If I have a client who is not going to commit the time or willingness to do behavioral conditioning, then this is our option. And we plan to do this maybe 3 to 4 times a year. So that's how we're able to do this. This whole process took 30 minutes. And then you can see this is a quick video of me going into the exam room. I'm sorry that it's a little bit shaky, but here he is getting his reversal. Mom and Dad were beyond ecstatic. This was a huge win for this dog, and really put their mind at ease about forming this relationship with the pet and having a way to provide medical care for him. So it was a great option on that regards. That's all the content that I have formally to present. A big thank you to the sponsor of this webinar, which is Reck Animal Health and their disinfectant technologies. It's really done a lot for the animal world. We really appreciate it in my practice. And now I'd just like to open up to any questions.
All right, thank you so much, Dr. Reck. We had a couple questions come through. The first one is, because you mentioned cats felt the change in environment might predict death, do you think that sound predicts impending doom for dogs too?
That's a great question. And I think that I think the answer ultimately is yes. And that is just based on watching. If you've ever watched a pet with true noise phobia experience a thunderstorm, they are going to exhibit high enough levels of fear, anxiety, and stress that it is not hard to imagine that that pet is not fearing for its life. You know, the clients will describe the pet as being out of their mind, right? Fireworks are another huge trigger of noise that will incite fear, anxiety, and stress to really, really high levels. So I love that question, because I truly do think for some of our canine patients that it does lead to that much of a sensation or overwhelming doom feeling that they could be at that level. Having the knowledge that that change of environment can trigger enough stress for cats that they can fear for their life is really, really important when we go to have a discussion about Previsit pharmaceuticals. In my practice, we truly do believe that every cat would benefit from being at least at a minimum on a nutraceutical support. Now, that is still very new information to a lot of pet owners, and we can have the problem where it goes in one ear and out the other. And having that little nugget, that little statistic of saying the number one trigger of fear in cats is changing their environment, which is inherent in going to the vet. And this is why I'm advocating that we be proactive about this, even for your kitten, because I don't want him to get to the point where he hates coming here, or he has limited medical care because it is so stressful for both you and him to get here. That is a real big takeaway, and something that I've learned to incorporate in my discussions with clients.
Great, thank you. And another one would be, what do you do if a dog does attack? What is the next step?
Okay, so I'm guessing that that question would be in regards to sharing General's case study. So, you know, if he does go ahead and attack, again, I mentioned that if that is at all in the direction of the pet parent, whether that is in the room or outside of the room, if we're at that point, then getting to a behaviorist is imperative. A lot of the behaviorists, if you do not have one close to your physical locality, a lot of them will do Skype consults with your clients, with you. So there are options with telemedicine now that did not used to exist. In the event, again, we did not put General in a position where he would have gone to attack us. A lot of that's because we knew his history of being capable of doing so from his other veterinary visits. So we set up that initial consult with zero expectation of the client, from the client, that I was going to even touch this dog, right? We get the dog on the PVPs that at the dose that I recommended. Now, PVPs had been tried, both trazodone and gabapentin had been tried on that dog, but never at the dosing levels that I presented to you guys and gave to that dog. I think he had been given like 100 milligrams of trazodone and 300 milligrams of gabapentin. And frankly, it's just not enough for his size and for his level of FAS that he comes with. So a lot of that question is, how do we do, what do we do if he goes to attack? I want to make sure we've done our due diligence, in that the whole goal is to make sure he's not even in a position where he feels that need. Because when they're, backed into the corner where they have to defensively attack us because they are that afraid for themselves, there's probably been a missed opportunity. Either, we need to go back to the drawing board on our medications, on how we're dosing it. We need to go back to the drawing board. Again, if we had brought General into the practice on the Previsit pharmaceuticals, instead of having him wait in the car, and now he's in the exam room, the catecholamines are rushing through his body, the adrenaline, all those hormones are going through his body, he's afraid. I give the owner the Cilio to give to him in the exam room. It might have taken way more than the 1 5-dot labeled dose for that dog to have had an effect. It might have taken 2 or 3 doses. All right. So be mindful that we want to try to intervene with that before the pet feels the need to be defensively aggressive. So I have not actually had a scenario where we could not get enough medications on board. And when behaviorists interact with their patients, it's a great question. You might think behaviorists get bit all the time, and they'll say, absolutely not, haven't been bit by a dog in 15 years, because they are that skilled at offering a medication protocol recommendation so that the situation can be safe for both the pet and the handler and the owner. But good question.
All right. And how large of a room would pheromone diffusers cover?
That's a great question. So the typical diffuser, I believe, will cover about 600 square feet. So that should be well within, you know, if you have a 10 by 10 exam room, that's only 100 square feet. So you're going to be completely fine unless you have a very, very large exam room. So we typically have a diffuser of each kind, feel away and adaptil, in each exam room. I typically have adaptil at the scale. I showed you pictures of my very large lobby, which is way more than 600 square feet, with 2 doors coming and going to the exterior environment. We initially had invested in having about 3 or 4 plugins of adaptil at different points in the lobby, and ultimately we just weren't confident that, you know, that investment, like 3 to 4 is an investment. You're approaching about $100 a month just to have pheromones in that one spot in your hospital. So we weren't confident that it was dispersing it evenly enough to have an impact when patients walked into the hospital. So we have them in the exam rooms. I have it at the scale. Then we have species specific whole, like animal wards. So we have a dog ward and we have a cat ward, and they are plugged in the respective wards in there. And those are under 600 square feet. So one plug-in works great.
Great, thank you. And our last question that has come through is, what research can you cite to support the idea urine and feces contain fear pheromones from exiting veterinary patients?
Got it. So that, I don't have any specific studies at the moment. Fear Free is launched a huge task force that is beginning to unravel that. The studies that I presented are from the bear animal usage studies in 2014. And, you know, in looking at that, so we can see that the documented evidence is that the fear is happening at the onset, before they even go into the clinic. And it's through discussions with behaviorists and, you know, other experts in those areas where we've kind of developed the insights that at this point in time, we suspect it is that the pheromones are in the feces and urines that are causing the stress to occur before they even know what the building is for yet, which is kind of remarkable. It definitely does seem to make the most sense and fit the model the most. One question I get asked a lot about is, well, can we do anything about that at the moment? And the answer to that is that the more we adapt to creating a fear-free experience, then the greater reduction in those pheromones we will see excreted into the environment around them. Of course, if you see opportunities where you can actually clean the areas and either use the rescue product or something that is going to remove the pheromones from that environment, that's great. But that's often not achievable in grass. It's not achievable on some of the surfaces that we're going to see outside. So if those are lingering, ultimately it is something that you will see improve slowly over time as you continue the fear-free journey as a whole organization. I always say that I'm certainly not the best fear-free veterinarian in the country by any means, but if there were to be a person who is the best fear-free veterinarian in the country, if they do not have a staff that can recognize signs of fear, anxiety, and stress, that can advocate for the patient's emotional well-being throughout that visit, they will fail, because it really does take the entire team to be supporting to truly make an impact in how these animals experience veterinary medicine.
Great, thank you so much. And if there aren't any other questions, we will wrap up. Thank you, Dr. Reck, for all of your information today. You've been super helpful. Thank you, Virox, for bringing us together today. And thank you, everyone who has attended. We hope that you enjoyed today's webinar, and it will be posted within the next week on fearfreepets.com. On that note, have a great day, and I will see you next time.